This is part of Alberta Healthy Living Program's video series, Helping You Feel Better After COVID-19. This session answers questions you may have about long COVID and who's at risk. So what's the difference between COVID-19 and long COVID? COVID-19 is a viral illness which affects the respiratory system and can present with typical symptoms of cough, fever, muscle aches, fatigue, and a loss of smell and taste. For some, this may feel like the flu, while we know that others have experienced more severe symptoms like difficulty breathing and required hospitalization. Others may not show any symptoms at all and only know that they're infected by a positive test. Most people who have COVID-19 recover within a few weeks. However, some people, even those with seemingly mild versions of the disease, continue to experience symptoms long after many others recover. This is where the term long COVID got its name, because the symptoms last much longer than expected. Long COVID is considered to be a multi-system illness with hundreds of reported symptoms. Symptoms may be new following an initial recovery from acute COVID-19 or be ongoing from the initial illness. And they can be physical or cognitive, meaning it can affect thinking and memory. Symptoms may also change or worsen over time, which means there may be periods of feeling better, and then you may experience a relapse or crash. The recovery is not in a straight line. It's more like a wave with good days and bad days, or good and bad weeks. Symptoms generally have an impact on everyday functioning and can affect your quality of life. It can impact your daily activities as well as work, leisure, and even family interactions. Unfortunately, we know that some experience long-term disability. We also know that people are affected differently and everyone recovers at a different rate. While many do recover, it may be slow and much slower than expected for a typical cold or flu. And because it's considered a new condition, we really can't say if everyone will recover. We do know that there are people that have been suffering for a long period of time with long COVID symptoms. Please note that this is a definition of long COVID for adults, and a separate definition might apply to children. How do I know if my symptoms are related to long COVID? Most people who have COVID-19 recover within a few weeks. Even those who required medical support begin to see improvement within that time frame. Some people report lingering symptoms beyond the expected time of recovery, 4 to 12 weeks or 1 to 3 months. And there's the long-term symptoms, which can continue longer than 12 weeks or 3 months. And this is both for persisting or new symptoms that develop. For anyone having ongoing or long-term symptoms, they're considered to have long COVID. Does long COVID have other names? It's important to know that there are several different names for long COVID. Long haul COVID, which was actually the name given by those living with the condition when it was first identified. Long-term COVID, chronic COVID, post-COVID, post-acute COVID syndrome, and post-COVID-19 condition, which is the name the World Health Organization has given to those who continue to have symptoms 3 months after a confirmed or suspected COVID-19 infection. Even though different names are used, they're all generally talking about the same thing. Who gets long COVID? We're collecting information in Alberta and from around the world about long COVID. Some research studies show that about 10% of people who get coronavirus will have symptoms for 12 weeks or longer. But it's estimated that as many as 25% of people will experience long COVID, which means that it would affect about 1 in 4 Albertans and millions of people around the world. Long COVID is still being studied, and there are many aspects of the condition that are not yet understood, like why some people develop it and others don't. Long COVID can affect anyone, old or young, male or female. While we can't yet predict who might get long COVID, there are an increased number of self-reported cases of long COVID in people who are middle-aged, females, and those working in certain fields like healthcare. We know that individuals who have had so-called mild as well as severe COVID-19 can experience prolonged symptoms or develop long COVID. It affects people who are hospitalized with acute COVID-19 and those who managed at home or in a community setting. Even people who are asymptomatic, meaning they experience no symptoms, can go on to develop long COVID. This is true regardless of age and prior health status. It affects people who are healthy and fit prior to infection, as well as those who have multiple other chronic health conditions. If you're unsure if you have long COVID, reach out to your healthcare provider or HealthLink or the Rehab Advice Line to discuss your symptoms and make a plan for your recovery.